Clinical features of arsenic chronic poison. Some clinical features should remember, that is loss of appetite, salivation, constipation, abdominal pain, vomiting, and soft and red gums, periorbital edema, and edema of ankle, voice is husky, and the main thing is raindrop pigmentation, that means generalized or localized fine mottled pigmentation of the skin. Raindrop pigmentation. And the next one is epithelial hyperplasia with keratosis, mostly seen on soles and palms. Epithelial hyperplasia with keratosis. And the next thing is Aldrich Mees line. Nails become brittle and show Mees line. The transverse white lines over the nail is Aldrich Mees lines. Okay, and there is nasal septum perforation, alopecia, liver enlarged, melanosis, headache, tingling sensation, numbness, muscle cramps, arthralgia, impotence, aplastic anemia, bone marrow depression, and anemia encephalopathy. And the next one is wrist drop and foot drop is common in chronic poisoning. The neuropathy is hallmark of arsenic poison, chronic arsenic poisoning, and it's resemble like Guillain-Barré syndrome. That is seen in weakness of muscle and atrophy. Okay, thank you.